Welcome back, viewers, to Tobago Updates Youth Wednesdays here this morning here at Portmore, Scarborough. I'm, of course, joined by the esteemed Dr. Faith B.Yisrael. She is the Secretary of Health, Wellness and Social Protection. So let's welcome Dr. Faith to set this morning.
Good morning, and thanks for having me.
Thank you for being
I forgot
here.
that today was Youth Wednesday, Okay, I feel better. Thank you.
Well, thank you for your reminder that today is Youth Wednesday, in figure, of course, and that you actually welcomed us to Youth Wednesday this morning, right? So we have a very pressing matter. Of course, a lot of people have been asking questions about dengue fever and the rise. I know that as a country, we did experience dengue fever in the past, right? So I guess this would be a reminder to viewers that had experienced it in the past. And of course, for youth viewers who are upcoming and had no experience in this, you now have a chance to learn about it.
Yeah.
All right. So Dr. Faith, once again, thank you for being here to discuss these parameters. All right. So what is dengue fever?
Certainly. So dengue fever is it's a disease that we get when we are infected with the dengue virus. There are several strains, for want of a better term, of the dengue virus. And when we get infected, we have a series of symptoms that it's because the virus is in our body and it is now affecting how our body functions.
Yes.
Of course, we coming out of COVID, we were hearing about the virus and all of that. And so this is just another one. Of course, we need to be cautious about it. And there have been cases in Trinidad that have been confirmed. It is one of those diseases that's been around forever and ever. There are always a few cases every year and that pop in and out. But we are encouraging people to be very cautious and to not take it for granted. Because even though dengue could be very mild, and for most people it is mild, I am sure you recognize the name dengue hemorrhagic fever.
Yes.
And the hemorrhagic fever part of it is when the dengue gets very serious and you end up starting to bleed. And you can actually bleed through your nose, you bleed through your eyes, you actually notice blood in your stool and that kind of stuff. And that part is when you're getting to the serious part of it, and that could actually cause death.
But this is rare.
This is rare.
Yes.
Yes. But what we are encouraging people to do is to try to prevent it in the first place. And part of the information that we are sending out is to say, yes, you may pick it up. Yes, you may get it. But definitely pay attention if you start getting some of these other symptoms, because that is when you need to actually get to the health facility. That is when you need to get treatment. That is when you may be getting to the point where your body is going into shock almost. And that is what can cause you to die.
Okay. And you mentioned symptoms, of course, when our bodies are fighting infections, we have certain things that we can look out for to know that we might be fighting against a virus or an infection, according to what the case may be. So what are the symptoms of dengue?
Certainly. So the mild symptoms, which are the symptoms you will normally get during the first phase of dengue, which is the phase that most people go through and come out of a fine. Headache, body ache, pain behind the eyes. So this is one, because the headache, the body ache, the nausea, the vomiting, that sound like everybody. That sound like everything, right? But you see that pain behind the eye, that is the main one that tells you, this one might actually be dengue. Because that pain in the back of the eyes, that is not a normal pain that we would get. So those are the common symptoms. And those are the ones that we tend to treat, on our own. You take something for the headache, you take something for the fever and that kind of stuff. But if you have the severe ones, which we're seeing on the screen, the belly pain, the tenderness, the vomiting, at least 3 times in a day, bleeding, as I said, in the nose or the gums, blood in vomit or stool, and you are extremely tired, it means that your body is going through significant challenges with this virus and you need additional help. That is where you need the medical professionals to come in and help you get through these because these can cause death.
And these symptoms, they come in more than one, right? In group. and not necessarily singularly.
Exactly. So it's
Because
usually the combination of the symptoms that you have.
yes.
And usually it's in phases. So so we did not talk about how you get infected. So you get infected by a bite from the mosquito. Of course, the incubation period, meaning the time between when you get the
Bitten
bites
and
and when
when
you
it would
start
see.
showing symptoms, is a couple days sometimes, right? So you're not going to get bitten and suddenly you have a fever. But you would recognize that after a while, you do have a sudden onset of a fever. So it feels like it came out of nowhere, but it's because you were bitten a couple days ago.
Okay.
Or you have that headache, or you have those things. And those are symptoms. Or you also may have a rash. And those symptoms may come on, suddenly. Of course, one of the things we tell people is that if you've come from a tropical area, so if you're living in the US, for example, and you came to the Caribbean and you're back in the US and you suddenly have a fever back in the US, it's probably because you got bitten by a mosquito in the Caribbean. But of course, we are in the Caribbean all the time, so we
Yes.
can't use that kind of tagline to help people identify whether they've had dengue or not.
Okay, so we're hearing that the contraction comes from, I'm going to mention the mosquito's name, of course, the Aedes aegypti mosquito, right?
So there are actually multiple types of Aedes. The aegypti is one of them, but there are others as
Right.
well that can infect you with dengue. Yes.
All right, so we're learning a lot here this morning.
So the bottom line is do what you need to do to ensure that you do not get bitten by a mosquito.
And of
Don't
course,
try to identify the mosquito. Try your best to not have the mosquito being bred around you and having the opportunity to bite you, whatever kind of mosquito it is.
I love how you put in try your best not to identify the mosquito, because honestly, I have been
Looking for
every
pictures.
time I get bitten is like, was that black and white? Does that mosquito have black and white feet? So please take the advice from Dr. Faith that we are not to look for the type of mosquito, but to avoid being bitten all entirely.
Avoid it completely because, again, because it is a virus, it means that we really don't have medication to treat the virus because it's very difficult to treat a viral infection. What we treat are the symptoms. So you take something for the headache, you take something for the fever, you take something for the bleeding. That is what we do. So we don't have, but because it is a disease that is totally preventable, that is where we are encouraging people to do all of the things that we normally tell you to do to ensure that you do not have mosquitoes around you. So what are those things? We know that mosquitoes are bred in areas where we have standing water.
Yes.
So anything in and around your home that can hold water. What are those? The old tires, the old pots, the old pan, the paint pan that outside that you wasn't really studying. Inside your home, it could actually be the flower spot that you are watering the flower spot, and water is settling in the little vase part at the bottom of the flower spot. All of those little areas, you may have a container in your washroom or in your bathroom because you're collecting water just in case Wassa decide they're not sending water. But even that, you have to be careful that it actually is kept covered because that is a perfect
I was to
breeding
ask you
place.
about that because in the shortage of the water shortages that we've been having, a lot of people are encouraged to save up their water. So in this case, we cover the water.
Yes, certainly. If you have to save up, if you have to store water, whether it's in a barrel, a bucket, or whatever it is, ensure that the thing that you are storing the water in is covered so that the mosquitoes can't go in and so that the larva can't get in and so that it can't breed develop into the mosquito that will then bite you and then transfer the virus to you.
Okay. All right. So you mentioned that we have a few cases in Trinidad. What about Tobago? Could you tell us a little bit about the statistics that we're looking at?
Certainly. So in Tobago, we sent out a press release on Sunday in the middle of all of the other activities that were happening on Sunday. We sent out a press release on Sunday indicating that we have one confirmed case in Tobago. And we say confirmed case because that case, the samples were taken from that client, that patient, sent to the Trinidad Public Health Lab and tested, and they sent back saying, yes, we have confirmed that this person has dengue. So what normally happens? How did we get to that point? At the beginning of the season, our public health Office of the County Medical Officer of Health sends out a notice to our medical professionals saying, hey, we're in the period, dengue is something that we're seeing popping up all over the world. We've got a notice from WHO or CAFA or whatever. This is what we want you to look for. This is the case definition. So if you see, as a doctor or a nurse coming into the hospital or health center, if you see somebody with this, the fever, the headache, the pain behind the eyes, that kind of thing, this is what we want you to do. You need to take the samples, you need to send it to the lab, and we will follow up and that kind of thing. If we find a case, then the public health department now steps in, goes to the house, make sure that we, clean, sanitize, spray out the house, and do a kind of spraying in the perimeter, so, the neighbors around, to make sure that we kill whatever mosquitoes may be there, since we know for a fact that within that area, there are mosquitoes with the virus in them.
And I was just about to ask that question. Sorry. We heard that Trinidad is putting things in place to spray certain areas, to fog certain areas in Trinidad. Would that measure be put in place for Tobagonians?
So not as yet, because part of our protocol, if we recognize the numbers in Trinidad are actually significantly higher than the numbers in Tobago. And part of our normal protocol is, as long as we find a single case that we have confirmed is a case, we go in and do the spraying, and we go in and do it. So we are not going to do an island-wide spraying, because that may not be necessary given the volume that we are seeing. When we continue doing our surveillance, if we recognize that Tobagonians are not following our recommendation, and then we realize that we're having a case in Charlottesville, Speyside, Delaford, Roxborough, Belgard, and we're going all the way, then we would have to take into consideration doing a larger spraying exercises. Yes. But for now, we are really just focusing on those areas where we know they are confirmed cases. And that's why I'm on TV at this hour of the morning, to encourage Tobagonians to please look around your house. Just take a little bit of time. Look around your house and think about areas that you may not have thought of before, that has a little bit of water settling, and ensure that you clean that out. Ensure that you scrub it out. So, for example, the case that the plant is in, the thing at the bottom that holds the water, even if you throw out the water, make sure and take it out and clean it out, because you may have the eggs stuck on it. So when water comes back again, the eggs reignite again and grow into the mosquito again. So don't just throw it out, actually clean it out, so you ensure that that does not happen.
All right. So we're getting into more of the public health arena, right? So before we go into that, we'll just take a short break, and when we're back, we'll discuss things about the consequences of our neighbors not doing that around the area, right? So viewers, I encourage you to share the live, share the live, share the live. We'll be right back. Welcome back to our viewers who joined us earlier this morning, and to welcoming our new viewers here this morning on our varying platforms. This morning we are joined with Dr. Faith B.Yisrael, our Secretary for Health, Social Protection and
Health, Wellness and Social Protection.
Health, Wellness and Social Protection. Thank you so much for that, Dr. Faith. We started off on a very intriguing, informative note about the dengue virus, how we contract it and so on. So I know I left you on a bit of a cliffhanger for those of you who might be having the problem. What to do if my neighbor isn't following the protocol to get rid of these environments where the mosquito can breed, because according to Dr. Faith, we can't keep looking for the color of this mosquito, checking to see if it's black and white, to see if we might contract dengue. So let's talk about who we have to report to, and how do we report to that person?
Certainly. So I'm hoping that if your neighbor is not following the rules, you can go over, because we're still Tobago, we're still wonderful, nice people.
Yes,
we can go over and remind them that they need to do this, and you don't need to report them, hopefully. But if you absolutely need to report, you could call the public health line, which is the 639-1433. That's 639-1433. Or you could email public.health@gov.tt. And I am putting my officers on notice. You better answer these emails. Public.health@gov.tt. And if push comes to shove and you need to find me to let me know, my social media
Is
is
always
all over
open.
open.
Yes.
Dr.
Very much
Faith B.
active.
And you can let me know. You can message me and let me know as well.
All right. So what to do if your neighbor is not following the protocol? Please call these hotlines. You can even contact Dr. Faith herself. All right. Okay. So we've talked about preventative measures. Let's talk about reactive measures in terms of I've already contracted this dengue fever. What is the protocol to follow when I present to the hospital, and what will be done when I do get there?
Certainly. So we don't. The vast majority of people who get dengue will actually not need to present to the hospital.
Okay.
Because the vast majority, if you are a child, for example, you are more likely to not even have symptoms. If you're a child, children are usually
Yes, they're
asymptomatic.
yeah.
Something about their resilience. And most people, the vast majority of people, would just have the headache and the body ache and the pain behind the eyes and that kind of stuff, which, we tend to do the things we do at home with that. But if you have the severe symptoms, the belly pain, the tenderness, the bleeding, if you're definitely seeing the bleeding and that kind of stuff, then you definitely need to go to the hospital and let them know that these are your symptoms. Let them know, for example, if you have been bitten by a mosquito within the last week or two of you coming to the hospital with these things, so that they know what to look for. What they will do then is, based on your symptom, treat you based on your symptom.
Yes.
But as I said before, the main thing is to try to prevent yourself from getting sick, because there is no antiviral medication, for example, that we can just give you and that takes care of it. No, what we are doing is basically treating your symptoms and hoping to keep you alive, because in many instances, not many, but in some key instances, your body can go into shock. And that is where we don't want to get to, because it means your organs have now begun failing. You are now actually bleeding really, really badly throughout. And then that means, the kind of treatment that you need now becomes intensive care kind of treatment to keep you alive. So it's really to pay attention to the kinds of symptoms you have, and if you recognize you're going into that realm of the severity, then get yourself to the hospital or to the health center.
Okay, so I heard you mention there was this big word that she called. So for our viewers that may not know what it means, the difference between antiviral medication and the immune booster, could you just give them touch on that?
Right. So so remember, dengue is caused by a virus. Antiviral meaning against the virus.
Yes.
So that is the medication that you will take against the virus, which is to fight against the virus specifically, which is the medication that we don't really have and we don't really use in Trinidad and Tobago, which is different to taking medication for a symptom. So you take something because you have a fever and you take a medication to get rid of the fever or to get rid of or to stop the bleeding. Those are different types of medications that you are using for the symptoms versus the actual virus.
Okay. Okay. So are there any home remedies? Because you said that most people will experience the more mild symptoms as opposed to the more severe ones, and I'm hoping that everyone remains in the vicinity of mild if we have to be contracted with dengue fever, right? So what could you mention some home remedies or prevention methods that we can do at home so that we don't overcrowd the hospital, overstimulate the staff?
No, I mean, there's the typical things, and I know that as a medical professional or as a health professional, we tend to use the fever grass and those things that we use normally to help us to get over the cold and flu and that kind of stuff. That is perfectly fine. Do not take anything that may cause you to bleed. So like Advil, for example, is one that we do not recommend because it may actually cause you to bleed. And remember, this is a virus that if it gets really bad, it causes bleeding.
Correct.
So you do not want to take any kind kind of medication, so you need to look at it. Whether, if it says that one of the things that it may do is like it's a blood thinner or it's causing you to
So that
bleed.
includes aspirin as well.
Exactly. Don't take those things, because you don't want a situation where you are bleeding more if you get to the point. But the other things that we normally take for cold and flu, even the traditional herbs and that kind of stuff, we have no issue with that at all.
So
And we are even recommending that for to prevent being bitten, you can actually use some of even the natural things that we are encouraging people to use to prevent yourself from being bitten. So things like lavender and peppermint and lemongrass, those oils that you could actually put on your skin,
yes,
those are actually oils that you could use to prevent the mosquitoes from biting you as well, outside of the normal mosquito repellent that you can buy from the drugstore or from the thing. You can use the natural mosquito repellents as well.
I realize that Dr. Faith only called the nice smelling oils. There is citronella as well.
Oh yes, and
that we can use.
Citronella not only repels mosquitoes, it repels other human beings as well.
So I mean, if you want to do both, by all means, citronella is available to you in your local pharmacies here in Tobago. All right. So we heard the name of the mosquito, that is Aedes aegypti. You said there are different breeds.
Yeah.
Yes, of Aedes Aedes mosquito. Right. The Aedes aegypti, however, that we've heard about causing that spread of dengue. Is it possible that we should be concerned also about the Zika virus and chikungunya? Because I know that mosquito also carried in the past.
Right, exactly. And that is why we are, the preventative measures that we are giving is to prevent people from getting bitten from mosquitoes generally, because you are right, there are other infections that you can get from Aedes and from the other types of mosquitoes that we have around, and you need to prevent all of them from happening. So it's a very generic kind of preventative mechanism that we are encouraging. If you prevent mosquitoes general from being bred in and around your surroundings, it protects you from dengue and all of these other types of infections as well.
Okay. In the past, of course, I know I mentioned the fact that you'll be doing the fogging. The public health sector would be involved in fogging the areas, right? What to do, or should not what to do, but hold on, let me get my facts straight. Right. So you said that you all will be going around fogging. So what about the checks from the public health sector?
Right.
We have, well, I mentioned the neighbor part about it, right? Given that you all are just doing the checks in places that are more prone to having mosquitoes breeding, not because of our household appliances or anything like that, but because we have streams and rivers nearby that may collect in little ponds
Yes.
around, right? What kind of checks would we be looking forward to? And also, where can we find the advisories that you all will be sending out in terms of telling the public where and when you all will be checking?
So if you recognize there are public health workers, perifocals and other workers who are continually roaming, you would find over the last couple months that random people have been coming around, knocking on your door saying, I am from the Department of Public Health, can I look around? So we have been doing those checks continually around. And when they come, they are the ones who identify, okay, ma'am, you need to move this, you need to do this. If we see that there is a water storage container, there's actually a chemical that we could put into the water that kills the mosquitoes. It allows us to still use the water, so it's not harmful to humans, but it will kill the mosquitoes and prevent them from breeding and that kind of stuff. So that is a continual thing that has been happening on the island, which may be why we have not recorded many cases before now compared to our brothers and sisters in Trinidad, because we have been proactive approach. We have been doing that. In terms of where you will find the information, the best place really is through social media. We have our Facebook page, the Division of Health, Wellness and Social Protection. The Tobago Regional Health Authority also shares quite a bit of information. We have our website, which I can't remember the site right now. So let's pretend I said we didn't say we had a website. Just go to social media, Facebook, and you will get the information. Division of Health, Wellness, and Social Protection. You will find information there, or you could come to my social media, Dr. Faith B.Yisrael, Facebook, Instagram, and so forth, and you'll find information there as well.
And I think I can openly volunteer Tobago updates to stay on top of the advisories that are being sent out by that division, of course, because we know we feed Tobago with the necessary information that is, of course, needed. So, Dr. Faith B.Yisrael, thank you so much for being with us here on Youth Wednesdays on Tobago Updates. The information was well received. I think our viewers are more informed of what is happening in the space and how we deal with the issues. So, viewers, I do encourage you to clean those barrels. Talk to the neighbor in a nice way and ask them to clean up around their areas as well, because we know if they are affected, we most likely would be affected as well, right? So thank you so much once again, Dr. Israel. And to our viewers who are still with us, we ask you to share the live, share the live, share the live.